I enjoy this job and I like the contact with people. Helping them is very fulfilling for me. I give them a part of myself because I have a specific relationship with each client. The aging population means there is a growing need for long-term care workers. We are in Benša Čiavnica, in eastern Slovakia, where a community-based pilot project has been set up to help older people to live at home for as long as possible. My name is Lucia Schneider. I am 38 years old and I have been taking care of my grandmother for about a year.
In this region of Slovakia, access to quality care and services for the elderly isn't always possible due to a lack of funding and staff. Lucia is a caregiver. She's lucky to be able to take care of her grandmother as part of her job.
So my job is to help my grandmother with cleaning, with shopping, and helping to take a shower.
Public spending on professional long-term care is low in Europe, representing only 1.7% of GDP in 2019. It often falls on the family to take care of their elders.
I'm glad when she comes at lunch. When she's here, I feel more lively.
Since the loss of her husband, Eva lives alone, and her small pension doesn't cover the cost of all her needs. So her family also supports her financially.
I couldn't go to a retirement home because my pension is too small to cover the payment.
But while she can, Eva prefers to stay at home close to her family. Projections show that in Slovakia, the number of people in need of long-term care will increase by more than 50% by 2070. This is double the EU's average increase.
So, what's the situation in Europe regarding the care sector? Here's our crash course.
Demand for care in Europe is going to increase as the average age of the population rises. There are 6 million people already working in the sector. And we'll need another 1.6 million care workers by 2050. Right now, a significant amount of care is informal and unpaid. 52 million Europeans, family members, friends and neighbours, offer care for people without pay or recognition. Meanwhile, professional carers, 90% of whom are women, are often undervalued and face poor working conditions. So the recent European Care Strategy is encouraging EU member countries to invest more into care, create new jobs, and make care more accessible, affordable and of higher quality. By 2027, a total of €6.7 billion should be invested into healthcare and long-term care in EU member states through the European Social Fund Plus. Maria lives alone and requires long-term care.
I often need to go to the doctor. Mr. Zorvan takes me to the hospital. He also waits for me and brings me home.
1 year ago, she registered with a community social service centre to one of the projects supported by the European Social Fund Plus. The aim is to bring together social health providers and municipalities to offer more services to the elderly. Now she gets assistance for essential transport and technological support at home.
This monitor shows temperature, blood pressure, and other things. All this is helping a lot, mentally and physically.
Pavel Chervienko manages the project on the ground. Today, he leads a consultation with the municipality and elderly people in the region to work out their needs.
We have come up with the idea of connecting municipalities into micro-regions. This way we can accumulate more funds and be able to pay enough carers and possibly motivate more people to start social work.
Pavel Adami is accompanied by Alžbeta, one of the project's social carers, who takes him to buy some food. For her, this work is a vocation that must be held in higher regard.
It is a very important job nowadays, so it could be better in terms of working hours and it could be better paid.
With a shortage of staff and growing pressure on public finances, the European Union has adopted a strategy to improve the working conditions of carers and enable the elderly to grow old with dignity. So what are the main challenges facing long-term social care in Europe? In Brussels, we put the question to Ivalo Kalfin, Director of the European Foundation for the Improvement of Living and Working Conditions.
Oh, there are many. Difficult to summarize them, but maybe the huge challenge is the access to long-term care services. Simply, there are many people that do not have proper access to long-term care. But the elephant in the room, this is the staffing and the carers. There are more and more needs for care workers in Europe, with an aging population. And there are less and less carers. You don't have enough young people in the care sector, and that gives very grim perspectives in the future if nothing is done.
So we were talking earlier about long-term workers, how to attract more people in that sector.
This is a very good question, and that's why the European Commission put forward a long-term care strategy. Of course, we need to talk about salaries, because the care workers are underpaid. But this is not only the salaries. There is a number of additional support which could be provided to care workers. For example, some more support for mental health, because they are working in difficult conditions. Then the training is also very important, because technology change, it might help, but it might be an obstacle. So it's very much needed that these people are kept up to date. Many of them are on short-term calls, so they have to be available at all time, but they also need to have the time to rest, to relax, to recompose before going back.
And when we're talking about the informal carer, the family members caring for their relatives, so how concretely could we support them?
This is even more difficult to support than the ones that are professional carers. All this informal care, in most cases, these are women, because women tend to work for less paid jobs, for more precarious jobs. And this is a stigma which continues since many years. Many of these people taking care of elderly or people with disability at home, they cannot go to work. So they have really very low income, and this is their job practically. So if we want to provide a decent minimum quality of life, they need to have also the support from the social system.
Thank you.
Thank you.